Good afternoon and welcome to It's Genetics, Baby, brought to you by the Hemophilia Federation of America's Families and Blood Sisterhoods Programs. I am Carrie Koenig, Families Program Coordinator at HFA. Also on the line we have Janet Chepka, HFA Programs Director, and Meg Bradbury, Senior Genetic Counselor at GeneDx. Just a few helpful hints before we get started. We have allotted approximately 1 hour for today's webinar. We certainly welcome your participation and will be requesting participation and engagement. However, your audio will be muted for the duration of our webinar presentation by our system, as it helps eliminate background noise. We do encourage your participation, and if you would like to ask a question, please utilize the chat tool at the bottom right of your control panel. We will then pass your questions on to our speaker. We will be answering all questions at the end of the presentation. We would like to take a moment to thank CSL Behring and the CDC collaborative partners for their support for our Blood Sisterhood program. We would also like to thank Genentech, Novo Nordisk, Bayer, Accredo, CVS Specialty Pharmacy, and the CDC collaborative partners for their funding of our Families program. Without their generous donations, this webinar would not be possible. Today's presentation is It's Genetics, Baby. We have an extremely knowledgeable speaker, Meg Bradbury. Meg is currently a lead or senior genetic counselor at GeneDx and started in the spring of 2013 in the neurogenetics department. She graduated from the genetic counseling program at University of Wisconsin-Madison in 2005. Prior to coming to GeneDx, she worked as a genetic counselor at the Children's National Medical Center, where she was part of a multidisciplinary neuromuscular disorder clinic, and she also coordinated and developed multiple research studies. Working briefly for the Johns Hopkins Genetic Public Policy Center and as a consultant for the Risk Evaluation and Education for Alzheimer's Disease REVEAL study, she went on to get her master's in clinical and translational research at the George Washington University in 2013, with an interest in translational research as well as health communication and genetic testing for bleeding disorders, using a mixed method approach. She is a member of the National Society of Genetic Counselors and several special interest groups and services on the NSGC Abstract Review Group for the annual Education Conference and the incumbent Abstract Vice Chair. She is also a board member at the Hemophilia Association of the Capital Area and Genetics Working Group. We just want to remind everyone as well that this webinar is for educational purposes only and is not intended to be construed as medical advice or the official position or opinion of HFA, its staff, or its board directors. Attendees are strongly encouraged to discuss their own medical treatment with their healthcare providers. Before we proceed, we would like to poll our audience. So I'm going to open a question right on your screen. Feel free to click on it and answer it. So please select all that apply. I am a woman with a diagnosed bleeding disorder, a woman with bleeding disorder symptoms, a carrier, a caregiver of someone with a bleeding disorder, or other. Thank you. Also, we'd like you to answer this following question. I have participated in genetic counseling in the past. Yes or no? Please rate your level of comfortability discussing genetic counseling with your providers. 1, you're extremely uncomfortable. 2, you are moderately uncomfortable. 3, neutral. 4, moderately comfortable, or 5, extremely comfortable. And lastly, have any of your providers talked to you about seeing a genetic counselor? Before I turn this over to Meg, I want you to take a moment to think about the 2 questions on your screen. They're brainstorm questions. Have you considered getting genetic testing? And if so, what additional information would you like to have? And with that, we can get started with our webinar. Meg, I'll let you take it from here.
Thank you so much, Terry, and thank you everyone for having me come and talk about a topic close to my heart. So these are going to be a little bit about what we talk about today, the who, what, when, where, and why. So jumping right in, so what do we mean by genetic counselor and who are genetic counselors? Genetic counselors can be viewed as sort of a medical advocate and counselor, and are trained healthcare professionals with a degree in medical genetics or genetic counseling from an accredited program. After completing their degree, they go on to get a certification by passing a specialized board exam that's administered and conducted by the American Board of Genetic Counseling, and that's the board that also provides that certification. So jumping right into what do genetic counselors have to offer, and really what is genetic counseling? So genetic counseling is a process that helps people understand and adapt to the medical and psychological and family implications of genetics and contribution to a particular disease. And the process of genetic counseling often includes several different areas, including sort of an interpretation of family and medical histories to assess the chance of a disease occurrence or reoccurrence in a family, education about inheritance, genetic testing options or other testing options, management, prevention, resources, and research. Counseling can also be involved to promote informed choices and help with adaptations to risk or a condition. So in order to really answer the question about what is genetic testing, we first must take a moment to sort of talk a little bit about what genetics is. And for some of you, this may be a review. But let's take a moment and do this brief refresher on what we're really talking about. So this is a picture of a cell, and our bodies are made up of these cells. And within almost every body within our cell are these instructions, and the structure that you see in the middle in blue, which are called the chromosomes. And chromosomes are made up of that sort of squiggly strand called the DNA. So when our body goes to read those instructions, let's use the analogy of like your grandmother's cookbook. It reads each letter that spells out those instructions. And the DNA or the recipes that sort of spell out those instructions help your body to create that protein. So an analogy I like to use is sort of talking about if you think about your grandmother's cookbook being full of different recipes and instructions, there could be, you know, one for a snickerdoodle cookie and one for a chocolate chip cookie. When you're going to read those instructions, you pull out that particular instruction and you look at the recipe, you collect the ingredients for that recipe, and then you would create that chocolate chip cookie using those particular recipes. So the body does a similar thing in that it reads that DNA. It then goes through sort of taking different elements and changing that and creating the protein from that instruction. Very similar to a recipe that you would get from your grandmother's cookbook. Well, so we just talked about how your body typically reads those recipes or DNA, but what happens when there's a typo in that recipe? Well, just like in your grandmother's cookbook, sometimes there might be typos and you still know what is meant to be said, and you can make the recipe without any difficulty. But sometimes those recipes, if they do have a particular change or typo, can really cause some trouble with the body reading those instructions and understanding what the end result or the protein is supposed to be. So this slide illustrates sort of with a simple sentence, and bear with me, I recognize that you often don't cook with any recipe that would say the red cat ran, but for this purpose, I think it illustrates some of those, what a typo could be. So if we take this sentence, the red cat ran, it reads pretty clear. You can sort of understand and you have a visual image or an end product that you could see here. If there's a small change that occurs, like maybe just a small typo, depending on where that typo is located, it might have a pretty significant effect. So in the first column, or the second row, you can see that the red has changed to VRD. So it makes not as much sense, and it really could sort of affect it, how this sentence was interpreted at the end. There can also be insertion, so the third one down, which talks about and has an I that's inserted, really sort of changes the whole way the sentence is read in the reading frame. You could also have a deletion, which can cause sort of a misunderstanding of the sentence, as well as duplications or inversions that can make it very hard for the body to really read that recipe or instruction. So these changes in the instruction can come about either by being passed down from generation to generation, either known or unknown in the family, or it's a change that can come about spontaneously or new. And geneticists like to call this de novo mutations or new mutations. So when would this information be helpful for you? Well, genetic counseling can be provided in a lot of different ways and have a lot of different impact and purpose. And what it can do is, it can help you to figure out what the chance of a bleeding disorder is sort of to be inherited or a new change that came about, like we just talked about. It could also be valuable, and it could relate back to you because it could help you to find out if you're a carrier of a bleeding disorder. It can also help to facilitate genetic testing and help you to understand what those results mean. So like we talked about with the sentence, there are a lot of different changes that can occur and have different impacts for you and your family. It also can be used to discuss the family planning options and to learn more about the higher probability of certain types of conditions. So talking a little bit more about the family planning piece, a woman who knows her risk of passing on a bleeding disorder to her child can better advocate for herself, as well as to help identify who in the family should be tested first. So often women at risk of being a carrier should get genetic testing done before pregnancy. So one of the reasons for this is that if the genetic variant that causes a bleeding disorder is known, then options for testing can be available. So those include both preconception and sort of post-conception options. So if we think about some of those preconception options, those could include in vitro fertilization, pre-implantation genetic diagnosis, or PGD. Post-conception options include amniocentesis, or an amnio, as well as CVS, or chorionic villus sampling, which would be testing done very early on in the pregnancy. And those tools can allow you to make choices both about whether it's delivering at an HTC, figuring out a delivery plan, and so physicians and families can take extra steps to create informed delivery plans. And these might be also utilizing tools like the MASAC guidelines. So some of those examples could be having discussions about having factor on hand, and this may decrease risk of complications during birth for both the mother and child, so for example, hemorrhaging. Take additional safety precautions, so using or avoiding certain assistive devices, whether it be electrodes that would be placed on the scalp and maybe avoiding those if the fetus was at increased risk, as well as planning after the baby is born. So thinking about when should particular procedures be done. So for example, a circumcision, should that be delayed for a period of time? So moving on to the where can I find this information about genetic counseling and testing? So there's actually a fair amount of resources out there, and this is a directory. You can contact your local HTC or OBGYN and ask to schedule an appointment with a genetic counselor. The National Society of Genetic Counselors has a resource online called Find a Genetic Counselor, and this NSGC website is found here on the following link. And within that link, you can select for types of specializations and then go on to select hematology and find particular genetic counselors that might be in your area. Another question that often comes up is about insurance coverage and costs. And it is possible that genetic counselors can be covered by health insurance. So we recommend that you check with your insurance company to sort of verify coverage and benefits. If there's out-of-pocket deductibles, what those might be, timing of figuring out when that's best to test, and you can also may need to figure out with your company, your health insurance company, if a referral from a doctor is needed. So there's also the option for support organizations and research studies who might offer genetic testing at reduced costs. And this could be through a study that shares that information with you, or different options out there. So please speak with your providers about what might be available for you and your family. So another question that often comes up is, how will my family and I be protected from discrimination about genetic testing? Well, in 2008, the Congress passed the Genetic Information Non-Discrimination Act, or GINA, and this law is focused on large insurance companies from using genetic information to sort of influence and raise premiums or refuse coverage or sort of determine eligibility. And to find more out about GINA, this information is readily available online, and you can check some of your .gov websites to find out more information as well. Okay, so we would love for you to stay online, and we do have a few post-webinar questionnaires, and we'd love to hear any questions that you might have as well.
Thanks, Meg. I did see some questions come in through that question box on the panel. So just a couple. Who or which doctor should I discuss seeing a genetic counselor with?
Oh, who or which doctor? So the question was who or which doctor should be discussed?
Yes.
So there's a variety of probably doctors that could help direct you in that answer. It could be your hematologist. It's possible that even your primary care providers might have some recommendations in your area. Often they could be affiliated with larger institutional hospitals that have sort of a more comprehensive care. But if you can't, by reaching out to your local hematologist, using that resource of the NSGC website might be an option as well.
Great. Thanks, Meg. I have another one that has come through. If I choose to seek some of the family planning options that you discussed, are they typically covered by health insurance?
They often are. Sometimes even providers, so it's important to check with your insurance plan and the institution that you're going to. A lot of times even that they can bill directly and bill through your insurance. Other times they might even be included in the comprehensive care that you're receiving at some of your HTCs, and that might not even be for an additional cost to have that genetic counseling.
Thanks, Meg. At what age do you recommend any genetic testing? I'm guessing that's kind of, so it's, as a carrier of hemophilia, I don't know whether my daughter is also a carrier. At what age do you recommend genetic testing for her?
Okay. So I think that's a great question. I think that the discussions, a lot of times if someone is, that depends a little bit on your family. Having that information and talking with a genetic counselor, even today can be appropriate because you can determine and sort of talk about some of those risk chances of, what are the chances that my daughter is a carrier, and then doing testing. A lot of times we've seen that, and we've talked a lot about in our community about the idea that carriers can sometimes be symptomatic. So having a discussion with your provider, both about, maybe getting levels, if that's something of a question, and genetic testing can be a part of that to sort of help inform that information. And especially if there's someone else who's been identified to have a particular genetic change, to go on and do that targeted testing, and other individuals might be appropriate. For individuals, for sort of family planning reasoning. Sometimes that conversation and that testing can be weighted and postponed until that sibling is old enough to sort of be part of that discussion and truly provide an informed consent, and making that decision of if testing is right for them and what they'll do with that information. But it can be a case-by-case basis to discuss with you and your clinical team.
Great, thanks, Meg. And there's one last one. What is PGD?
PGD stands for pre-implantation genetic diagnosis. And what that is so the implantation is talking about that you can have an egg that is fertilized, right, outside of the woman's body, and you can test at a very early stage by just taking a couple of cells after the cells started juddering, and you can select out a couple of those cells and test for genetic changes. And you can determine from that information if you want to maybe select for hemophilia and you would like to have a child or a carrier, or sort of select early stage fertilized cells that don't have that, and then that gets implanted in. So a lot of this is a technology that's used in other conditions and disorders, in particular for women that sometimes have fertility issues. This is also a technique that can be used. So it can be a helpful approach for women to sort of know those pieces ahead of time. And that's something to talk about with your providers about, is this an option? Is this right for our family? But having that genetic answer is sort of required to even do some of those procedures and go down that direction.
Great, thanks, Meg. Well, again, thank you so much for that insightful presentation, and thank you all for your many questions that have come through this afternoon. Before we sign off for the day, we did have some post questions for you to answer. So I'm going to go ahead and launch those now. As a result of participating in this webinar, my level of comfortability discussing genetic counseling with my providers is 1, extremely uncomfortable, 2, moderately uncomfortable, 3, neutral, 4, moderately comfortable, and 5, extremely comfortable. Give you just a second to go ahead and put your responses in. And last but not least, I would recommend, I'm sorry, I have to click launch. I would recommend this webinar to others, yes or no. Again, thank you all so much. We have recorded this webinar, and it will be available on HFA's social media and website within the next 2 days, so please check back with us. Thanks again, Meg. I hope everyone has a wonderful day.
Thank you.
Thanks, Meg.